So the ground rules for this are going to be that I know that there's a lot of passion. There's a lot of strong feelings about this vaccine, for and against. So the ground rules are respect. And then if you're not a panelist or myself, you're going to remain on mute. I received many, many questions from people, and they've been greatly appreciative. And basically, we're going to go through those questions first. But if you want to submit a question, go ahead and please type it in the chat, and then we'll get to that. And then if I see that you've typed a question and it's actually already on the list of questions we're going to ask, I'll just bring that up just to let everybody know that, hey, I acknowledge that and we're going to get to it. So the format is going to be question and answer. Each of the questions have been given to one of the panelists. So I will go ahead and read the question, give it to the panelists, and they'll respond. And with that, we will get started. Colonel Desena, can I ask you to give your welcome, please?
Yes, thank you, Captain Pytlik. Good evening, Connecticut National Guard, senior leaders. Thank you for joining us. To Connecticut, we had our most historic moment. And for those of us in healthcare that have been fighting this pandemic on a clinical realm since March, we've seen the devastating effects of what this disease does to our patients. And not only old and infirmed, but we've seen the spectrum throughout, even the healthy and the young. And for us to have a protection, for us to have an answer to the beginning to getting life back to normal, it's our job in healthcare to make sure that you have an informed decision. Our job of giving patient education is just as important as getting the vaccine into your arm. And so that's why we felt it was most important for us to be here to answer questions. And thank you so much for the very in-depth questions that were brought in from the field. So the vaccine, the COVID-19 vaccine developed by great scientists, some here right in Connecticut, is under emergency use authorization, which does mean it is a voluntary vaccination for our service members throughout the Department of Defense, including Connecticut National Guard. We will have panelists here, and everybody will have a chance to explain their background, their experiences, in order to give everyone here some detail. So myself, Colonel Mike Desena, the Army National Guard State Surgeon. My background is in correctional healthcare. I just retired from the Department of Corrections, and I've seen some of the devastating effects, what we call a congregate setting throughout the pandemic. Also fortunate to see the amazing work that gets done within the National Guard and how we respond to the state of Connecticut. So in that breath, not only you are our main customer, our main patient, it's your families, and how your decisions there does affect your families. Just as you serve your uniform, we know our families serve with us. While this vaccine is getting wild acceptance, as Captain Pytlik said, we know that there are some questions out there, and that's our job, is to answer those in the hopes to get our lives back to normal. Captain Pytlik, thank you for your opportunity, and I'll turn it back to you.